I'd like to talk about sleep apnea, Dr. Zaibak. And, lately there's a tremendous amount of news out there that apparently the medical field is starting to realize, not because they were dumb and stupid before, but, research and whatever, that people who are fatigued, tired, exhausted in the afternoon literally fall asleep almost out of control, that there is more car accidents, people falling asleep, than there is people drunk driving. In fact, the car accidents with the people falling asleep seems to be worse because they just pass out and they go straight wherever they go to. At least the drunk guy, he tries to fix it. Tell us about sleep apnea. Is it really that severe? How does it come from? Does every person who snores have sleep apnea? Give us the gist, the rundown.
Usually most people who snore, they have some sort of sleep apnea. It can be dangerous. There are studies that show that there's people that even suffocated while they were sleeping. It can cause a lot of problems. It can definitely ruin your lifestyle. So we get a lot of patients who come in for sleep apnea, and it's very easily treated usually with an appliance.
Okay, now the appliance is what kind of? What are we talking about here?
It's basically a plastic appliance. It's a dental appliance, and it positions your jaw in a certain position, so therefore your tongue does not kind of constrict on your airway, and therefore allows smoother air entrance and exiting, therefore allowing you less snoring and a more comfortable sleep.
I see. So it's kind of a mouth guard to a certain degree.
It's a mouth guard, but a mouth guard that positions your jaw in a certain position forward to position your tongue in a more position to decrease the chances of it blocking your airway.
Now, it makes lots of sense that people, first of all, sleep apnea. What it means is, I guess, some people, they get tested for this. I mean, it probably when you're tired, exhausted in the afternoon, and when you tend to want to fall asleep, and maybe you can't because you're at work, but it feels like that. Or if your partner knows that you're snoring and even stop breathing. I have heard that some tests reveal that people stop 20, 30 times an hour breathing, sometimes for up to a minute, sometimes less, sometimes a little more, and that people who sleep apparently 8 hours in bed really only sleep a couple hours because they never reach the deep sleep because they get woken up, and apparently they don't really realize that they do. Is that true? Can it be that severe?
Yeah, obviously there's stages of sleep, the REM, and so on, and if you're constantly being waking up, you're not getting your full 8 hours of sleep. So technically, you could be in bed laying for 8 hours, but you really didn't get your full 8 hours sleep. I've usually seen patients who have sleep apnea Usually I'm seeing a trend of having what we call macroglossia, which is a larger tongue than normal. And those are the patients who tend to kind of block their airways and would benefit very significantly also from a sleep apnea appliance.
Also, people who are a little bit overweight, and especially who somehow put on like a second chin, apparently are very prone to have that. Is that true?
Yes, absolutely.
Now tell me, so obviously when a person gets oxygen deprivation and all that, yes, again, it's the lifestyle here. People who are who are tired and exhausted, they're just not imaginative. They don't go for new goals and things as much as another person. They don't solve existing or problems as much because they're tired. I remember 22 some years ago when my wife and me, first got married, and she would, at times she would say, why are you upset, honey? And I go, I'm not upset. And she says, honey, you're upset. And then I say, yeah, I'm getting upset because you're telling me I'm upset. But what happened is, she says, but Why are you so quiet? Because I normally, talk 24 miles an hour. And what really happened is she found out really a year or two later that whenever that happened, I was tired and exhausted. So I was sitting at the kitchen table lifeless. I was driving in the car lifeless, where I'm normally all full with new and old stuff and garbage, and it just comes out. So when people are when they don't sleep, they will have that. And instead of getting a afternoon pickup with a Red Bull or a cup of coffee or any other type of whatever, maybe a trip to the dentist to get a good night's sleep, which they don't even know they don't have, would solve the problem.
Absolutely. I mean, let's think about it. If you haven't slept your 8 hours, you tend to be cranky, you tend to be tired, not motivated. You're unhappy. So if you take a look when you sleep your 8 hours, you're feeling more energized, you can get more done. And a lot of this can be corrected by something as simple as a small appliance that you put in your mouth, and now you have your 8 hours sleep, and get your energy instead of taking 5 hour energy drinks and things like that. And it's just much healthier. But a lot of patients, the problem is they're not aware that they have sleep apnea.
Well, even the dentists weren't aware. I mean, the doctors weren't aware of it, and even most dentists, they're not. Most dentists sell or do the treatment of sleep apnea when patients demand it rather than educating it, because it is actually a relatively new finding in the medical field that it is happening. They knew it was happening, they knew people snore, they knew those things, but they didn't know apparently the real effect. Like in New Jersey, it was only a few weeks ago, apparently a bus driver wrapped the bus around the ball and killed a bunch of people, and they heavily suspect it was sleep apnea.
So it's unfortunately it's a shame, but yes, I mean. Now
let me talk about something else. There is another appliance out there rather than the dental appliance which fixes that, which is the CPP mask, CPP whatever, a mask, oxygen mask. Don't know what you call that thing. And you basically get ambient air pushed in, maybe a little bit humidified with some water, or whatever. But either way, and you breathe. And while that machine apparently is super good, most people, almost all people, simply can't stand it. Which means you have something very good, maybe better than the thing you dentists make, except people won't wear it. They can't sleep with it. Do you have some stories about that? Do you have some? Do you have found that to be true?
I've heard of different stories. Obviously, that's not an appliance that we use. We only use an internal mouth appliance. But I've heard that they tend to be uncomfortable for the patients. So they may give you the results, but if it's not uncomfortable, the patient doesn't use it, and therefore
doesn't wear it.
You don't wear it, so you're not correcting the problem.
Well, like one of the sports teachers.
It has to be comfortable.
Right. Well, like one of the there's a sports teacher I know, and I've never, done training or something with him. But anyway, I know the guy, and one time I asked him, I said, so what's the best sport, the best exercise to do? I was expecting him to say something like swimming, bicycling. I hoped he said skiing, since I love that. But anyway, he looked at me and says, Helmut, the best exercise will be the one you will do. So,
What's that?
Well, for me, oh yeah, you mean nothing? Well, the point is, if we don't do it, it doesn't do any good. And apparently that mask has that, but it is available out there. Thanks for explaining this whole thing to us very much. Bye-bye, Dr. Zaibak.
Thank you.